All right, I will start. Welcome, everybody. Happy Monday, and thank you for joining us. I just want to introduce Tanny Coward. Her and I are newly minted 2020 Women Heart Champions. This is part of a program that we'll be doing for the rest of the year, hopefully one a month, so let us know what you want to hear. I am thrilled beyond belief to welcome Dr. Lewis and Dr. Kelley-Hedgepeth to share with us COVID in Your Heart today. They are both co-directors of the Women's Cardiology Program at the Lown Group. I've been under Dr. Lewis's care for about 5 years, and you've heard me post and say before that she's responsible really for putting me back, both physically and more importantly mentally, after my heart attack. So I'm thrilled to have them both here to talk to us. There is a comment section on the right-hand side, so if you have questions during their presentation, they have graciously offered to do a Q&A afterwards, so just post your question in the comment section and I'll be tallying those for afterwards. And with that, I'll hand it over to you both. Thank you so much.
Thank you, Maggie, and thank you, Tanny and Women Heart, and all of you for joining. This is really exciting for us to be part of this. I haven't done a Facebook event before, so bear with me, and I'm going to try to logistically get through this as smoothly as possible. So I'm Dara Lewis, and this is Alyson Kelley-Hedgepeth, and I'm going to start first by talking a little bit about COVID in general, and then COVID and the heart, and then Alyson's going to take over and we'll talk for about 30 minutes and then take any questions you have. We would love to hear the questions. So I am going to share my screen here, and let's see. Okay, does that work?
Yep.
Great. So as Maggie said, Alyson and I are both cardiologists at the Lown Cardiology Group, and we have founded the Women's Cardiology Program. And we also take care of general cardiology patients. And of course, as every doctor has been in the last 10 months, we've been seeing COVID patients as well. So we want to talk about COVID in general, and then COVID as it relates to heart disease. So COVID-19, the timeline and the stages of illness and the role of heart disease and the relationship to COVID is where I'm going to start. So COVID has 3 stages of disease, and the first stage is the mild phase, the early phase, which is the first 8 days or so of symptoms. And most people, 80–85% of patients, get COVID and fully recover, or 90% recover, and don't progress onto the more severe stages. But I'm going to talk a little bit about stage 1 because that's the most common. So the symptoms vary early on, but very often they affect the upper respiratory tract. So sore throat, cough, and fever would be very common. Less often, GI symptoms like diarrhea, nausea, vomiting. Sometimes it's body symptoms, what we call constitutional symptoms, flu-like symptoms where you feel tired and achy, chills and headaches. And as you've probably heard, a key feature of COVID and sort of special to COVID is a loss of taste and smell. So in the first week or so of symptoms, it's usually these, I hesitate to use the word mild because people who've had it say it's really quite miserable, but it's mild in the sense that you're not unstable, you don't need to be in a hospital typically. And the goal of treatment at this point is to support your immune system so you can fight off this virus. And the symptoms usually will improve all on their own by about a week. If you do get COVID, you still might be contagious though for up to 10 days. So after the symptoms fully go away, you don't want to be around other people for at least 10 days. About 10–15% of people don't get better and progress onto stage 2, which is the stage where it enters the lungs. So the virus attacks the lungs and gives you COVID pneumonia. This is the next week, so about days 7 to 14. Most common symptom at this point is shortness of breath and a dry cough. The shortness of breath is often better lying on your stomach. And again, if your oxygen numbers are okay and you're not terribly short of breath, you can usually stick it out at home, but you have to be in very close contact with the medical system here, ideally monitoring your oxygen level. And then if things start to take a turn for the worse, if your oxygen levels drop below 92%, cough is getting worse, you may need to be hospitalized. The treatment goal here is to support your immune system to fight the virus. And sometimes we use a medicine here called remdesivir, which is an antiviral medicine. and that's used in patients who are hospitalized with the COVID pneumonia. And another 5% or so do not recover from the COVID pneumonia and progress onto the advanced stage. This is the severe stage called cytokine storm, where the body's immune system actually overreacts. So initially we want to support the immune system to fight the virus, but people who go on to stage 3, their immune system is going overboard, and it's actually starting to attack not just the virus, but attacking the body's own organs. So after 2 weeks or so, if things aren't getting better, they're often taking a turn for the worse, where there's inflammation all over the body and every organ in the body. The heart, the kidneys, the pancreas, the liver can be affected by this. And this is the stage where we often see cardiac complications. So the heart can get inflamed as well. And the goal of treatment here is actually the opposite of what we were doing in stage 1 and 2. We wanted to support the immune system in stages 1 and 2, but if you get to stage 3, we try to suppress the immune system because it's the immune system itself that's causing a lot of the problems here. So this kind of looks at it as a picture here, and if you look up on the left side, this early stage, early infection where the virus is causing the problem can progress into the lung phase or the pulmonary phase, and if you don't get better there, then the host inflammation phase takes over, and that's the hyperinflammation phase. So this is the time course over time, again, first week, second week, and third week over here, with the severity of illness increasing over time. So the symptoms in the beginning, you might have a dry cough, a low-grade fever, chills. Second stage is shortness of breath, and the oxygen level may drop. And the third stage is where you can have heart failure. And I know a lot of patients on this Facebook page already have heart issues, and we're going to talk about that. And it can progress through the lungs, causing a need to be in the intensive care unit, sometimes even on a ventilator. So there's a lot of treatments out there that have been thrown around and tried. Only one is FDA approved for treating COVID, and that's called remdesivir. That's the one I mentioned. That's an antiviral medicine that shortens the recovery time, and it's used for patients in the hospital who have moderate disease. It's not useful in mild disease, and it doesn't appear to be useful in critical disease. But that remdesivir is very useful in moderate disease. These fancy names, tocilizumab, bamlanivimab, are what we call monoclonal antibodies. And these are used when we want to suppress the body's immune system and fight interleukin-6, which is an immune modulated protein that the body makes to fight virus. Steroids like dexamethasone can be useful as well to suppress the body's immune system, so in that advanced stage. And then you may have heard people talk about blood thinners. So some people are getting more blood clots when they get COVID, and we'll talk about why that is. But we use the blood thinners here for people who are at high risk to get a blood clot, either because they're at bed rest or because they've had a blood clot before. We don't put everyone on a blood thinner. And then you've probably seen convalescent plasma, so they take blood from people who've had COVID and who've recovered and hoping to extract those antibodies and give them to other people to help fight. No impressive data yet that that's useful, but still being studied. And hydroxychloroquine also early on was very exciting and turns out not to be useful in reducing death rates. All right, so let's shift gears and talk a little bit about heart disease and COVID. So we know from early on, from China, from Europe, from the US, that people who have heart disease are more than twice as likely to get really sick with COVID as people who don't have heart disease. And why is that? Early on, we didn't know why. We do know that any disease or any condition that suppresses your immune system makes you more likely to get COVID. So that would include diabetes, that would include autoimmune diseases, that would include people who are on medicines like chronic steroids that suppress the immune system. But why heart disease? Well, it seems to increase the susceptibility to getting COVID in the first place. And then more importantly, it increases the likelihood that if you do get COVID, you'll get really sick with it. So the susceptibility part, it's probably not the heart disease itself that makes you susceptible. So it's not that you have a weak heart that makes you susceptible or you have high blood pressure that makes you susceptible. It's most likely that the people who have those conditions have poor cardiometabolic health. And that poor metabolic health weakens the immune system and makes you more susceptible. So people who have high blood pressure, for example, are more likely to be sedentary. They're more likely to have obesity. They're more likely to have diabetes or pre-diabetes. And we know that all those things increase inflammation in the body, and inflammation can weaken the immune system and make you more susceptible. So if you're exposed to a bit of virus with a very strong immune system, you're more likely to fight it off. But if you're exposed to the virus with a weak immune system, you're more susceptible to catching the disease. Once you get the disease, you're more likely to get very sick if you have an underlying condition that makes you more vulnerable. Because anyone who gets an illness that includes fevers and blood pressures bouncing around and heart disease, fluid in the lungs, low oxygen, these things make you less likely to survive. It's like you may have a hardy boat on the ocean, you'll survive a storm more than if your boat is a little bit weak to begin with. So the conditions that make you more at risk for severe disease and death would be starting out with a weakened heart, starting out with blocked arteries to the heart, and starting out with a tendency to have blood clots. So when you start out with a weak heart, if you get further inflammation on top of the heart and it weakens it more, you're more likely to run into big trouble. If you start out with blocked arteries in the heart, so the heart doesn't get quite enough oxygen, and then you make the heart work twice as hard with a fever, and you drop the oxygen levels in the blood because of pneumonia, then the heart muscle is really not going to get enough oxygen, and then you can have a heart attack. Blood clots can be caused by two things. One is that any type of inflammation or infection causes your body to make more clotting factors. That's evolutionarily the fight or flight. You're ready to get wounded, and to make a clot is favorable evolutionarily if you're under stress, but it's not favorable if you're lying in a hospital bed, not moving. So more clotting factors make you more likely to make a blood clot. The second reason people get blood clots in COVID is that any inflammation, whether it's from infection or from diabetes or from anything of the things we've talked about, causes the lining of the blood vessels to be disrupted. And the lining of the blood vessels normally helps you resist blood clots. And if it's disrupted, it's more vulnerable to making blood clots. So more clotting factors and a disrupted lining is a bad combination and can cause increased blood clots in the lung, called a pulmonary embolism, in the heart arteries, causing heart attack, can be in the legs, causing a deep vein thrombosis. So heart injury, which is measured by a blood test called troponin. Troponin is an enzyme that is located in every heart cell, and it's released when the heart cells are damaged. Heart injury can be detected in up to a quarter of patients who have severe COVID disease. Often they're asymptomatic from a heart standpoint, but sometimes they get something called myocarditis, which is inflammation of the heart muscle. So either the virus directly attacks the heart muscle cells, and that's called myocarditis, or the inflammation cytokine storm that's going throughout the whole body causes inflammation in the heart just as it does in the other organs. So myo means muscle, carditis means inflammation of the heart. So inflammation of the heart muscle causes weakening of the heart muscle. It also makes the muscle more prone to arrhythmias, so irregular heart rhythms. Supply-demand mismatch refers to the mismatch between oxygen supply and oxygen demand. So I started to talk a little bit about this before. Oxygen supply is how much oxygen is in the bloodstream. So if you have pneumonia and your oxygen levels drop, that reduces your supply. If you have anemia, you can't carry that oxygen, and that reduces your supply. And then demand goes up. So supply can go down in pneumonia, and demand goes up because the heart has to work much harder when there's fever, when the blood pressure is bouncing up and down. And when you have more demand for oxygen for the heart muscle, with decreased supply, you can have heart damage because the heart's not getting enough oxygen. And then finally, you can get a blood clot that clogs up the heart arteries themselves, blocks blood flow to the heart muscle, and that can cause a heart attack. So heart involvement can take many forms in COVID, and these are all potentially fatal disasters when you get these in COVID. So what's the good news? The good news is you can lower your risk. You can lower your risk of catching COVID in the first place by improving what we call your cardiometabolic health. So eating a healthy diet, exercising, and Dr. Kelley-Hedgepeth is going to talk a little bit more about these preventive measures, getting enough sleep, and avoiding cigarettes and alcohol will all improve your health and improve your immune system's ability to fight this off. And importantly, if you get sick, you should be prepared before you get sick. Ideally, if you can find a home oximeter, these little machines that clip on your finger and measure oxygen, that's a really useful thing to have if you're sick at home by yourself, especially if you're trying to avoid, as we all are, trying to avoid going into the doctor. You can call your doctor every day and say, my oxygen is 98%, my oxygen is 98%. And if one day it drops below 92, 93%, that's a sign that perhaps the infection is spreading through your lungs and you may need to go to the hospital. If you live by yourself, it's really important to have somebody check in on you every day. It could be by the phone, could be a neighbor or a friend or a family member, but just to make sure that every day you're monitoring your symptoms. Because that first week, as I said, is usually mild, and the second week, kind of touch and go and could be moderate. And if by day 13, 14, you start to get sicker, you'd want someone to know about that. And when in doubt, you should definitely let your doctor make all these decisions, especially if you start out with heart disease. And then you've probably heard this term long hauler. So COVID, once it's gone, it often lingers. Some of the symptoms linger. And one study showed that 2 months after the COVID had resolved, patients had at least one symptom of the following in 90% of cases. So most people have lingering symptoms for over 2 to 3 months. And those symptoms include fatigue, shortness of breath, pain in the chest, pain in the joints, brain fog, difficulty concentrating, mood changes like depression, and a rapid heart rate, or a condition called POTS, is actually fairly often seen after the long COVID recovery. And if we do magnetic resonance imaging on patients' hearts at 3 months, more than 2/3 have evidence of heart inflammation, even though they may have never known they had a heart problem. So to summarize my piece of this, and then I'm going to let Dr. Kelley-Hedgepeth take over. There's 3 stages of disease in COVID. Most people go through the viral stage and recover. About 15% go on to develop pneumonia, and about 5% go on to develop hyperinflammation and cytokine storm. People with poor metabolic health have increased inflammation, which weakens the immune system and increases the risk of contracting COVID. And people who start out with underlying heart disease, congestive heart failure, are more vulnerable to the complications if they do get COVID. And in many cases, recovery can be long and slow, and therefore, prevention is always going to be the best strategy. Thank you.
Well, that was such a nice overview. Thank you, Dara. I'm just going to share my screen now. And I think we'll probably have a lot of questions because that component of the talk really has a lot of technical aspects, and certainly Dr. Lee Lewis and I will be available to add some clarity. But I want to continue and talk about who's at risk and highlight some preventative strategies. So I thought I would just start by showing a current map of the United States to just remind all of us that we really are all at risk, and we're really living through this as a nation and on the international front together. So even though it's easy to feel isolated, this is really a shared common experience, and the message that we're giving to this group is really the same that we're giving, to our patients when we see them in the office, and that's really a cautionary tale of working to prevent your exposure. So unfortunately, over the last 9 months, we've really seen significant hospitalizations and unfortunately deaths related to the COVID-19 pandemic. And I'm going to go into some of the details about who's at risk. But this is the title of a JAMA article, which most of our scientific publications have really switched in the last few months to be focusing almost entirely on the COVID-19 pandemic. So this was an article that was just published looking at all-cause mortality in really young people, aged 25 to 44, and seeing the significant impact of COVID-19. So obviously this is something that is touching all of us, regardless of age. Certainly as we age, we are at higher risk, and those are for complex reasons, as Dr. Lee Lewis pointed out. But if you're over age 65, age alone puts you at a much higher risk of being hospitalized and certainly to get severe illness from COVID. This is an updated list from the CDC, and I apologize for the long list, a busy slide, but these are who we think are really at increased risk. So apart from age, if you have a diagnosis of cancer, chronic kidney disease, chronic lung disease, as Dr. Lee Lewis said, if you have heart failure or coronary disease, if you have an immunocompromised state, if you have obesity or severe obesity, pregnant women, those with sickle cell disease, current smokers, and those with diabetes are really at high risk. We also have a long list of people that may be at higher risk. And I show you this not to kind of overwhelm people with details, but just to highlight how many people are really at risk to have severe illness when we're talking about COVID-19. And unfortunately, we see that reflected in the hospitalization rates. And November was really a hard month for the entire country, where those hospitalization rates were really the highest that we've seen. So this is something that is very timely and is important for everyone to be putting into practice now to make sure that that we mitigate our risk going forward. So as we age, certainly the risk of hospitalization and more severe complications increase with each increasing decade. So our advice to our patients when we see them in the office, and also to all of you, is to really focus on prevention, especially until we have the vaccine available to most of us. We really need to prevent the spread of COVID-19. So I've put together a list of top 5 recommendations that your cardiologist would want you to know. I'm probably dating myself a little bit, as this is a throwback to David Letterman's top 10, but I tried to condense it for all of you, and hopefully some of you are snickering with that. But number 1 on the list is please wear a mask, practice social distancing, and wash your hands. Obviously, defending against infection is our best way to make sure that you stay healthy and continue to physically isolate. It turns out that if you have the seasonal flu and you're infectious, you will infect 1 to 2 others. The transmission rate of COVID-19 is slightly higher than that. So if you have active COVID infection, you will transmit to 2 to 3 other people. The good news with this is it's not as transmissible as we initially thought. 8 months ago, we were concerned that it would be even more infectious with SARS and be infecting 3 to 5 or even more people if you were infectious. But it is still more infectious than the seasonal flu. So our efforts to really prevent the spread of the virus are so critical to our efforts. So that includes just understanding your risks when you do go to social gatherings, which is so important now heading into the next 2 weeks of holidays. Obviously, the lowest risk is virtual activities where you're clearly isolated from people that may be infectious. Higher risk activities are considered those that have medium-sized gatherings, especially if you're less than 6 feet away from each other. And of course, there's some modifying factors with all gatherings. So the duration that you're there with people, if you're face-to-face with someone for more than 15 minutes, that increases your risk of catching an infection if they're actively shedding viral particles. Also the location of these gatherings, if you're at an indoor event where there's poor ventilation and low air circulation, that also increases the risk of the infection rate and transmissibility. And of course, behavior at the event. So for all these social gatherings, if you're going to be together eating and masks are down, that also increases the rate of transmission. So we want you to just keep all of that in mind and really work to keep yourself safe. Next on my top 5 lists is to remind you to get your flu shot. This is so critical to all heart failure patients and all cardiac patients. And I just want to remind you, because you've probably heard this over the years from your cardiologist, but if you have a diagnosis of heart failure or coronary disease and you get a respiratory infection, just like the seasonal flu, you are 5 to 10 times more likely to end up with a heart attack or with decompensation of your disease and end up in the hospital. And that's an important number for you to keep in mind, because that's also really preventable. So getting your flu shot, getting your pneumonia vaccine, and taking those precautions to avoid transmission has a huge impact on prevention and keeping you as healthy as possible. Number 3 on my list is don't ignore your symptoms or delay your treatment. And this is really important. I know Dr. Lewis went through some of those symptoms that you would want to seek emergency care for. Early on in the pandemic, we were really fearful going to the emergency room. And now that we're 8 or 9 months into the pandemic, we certainly are utilizing hospitals in a way closer to how we were before for emergency care, but still not quite back to the level that we were. So this was a European Heart Journal article that was published in June, right after the peak of the pandemic in Italy that was hit very hard around the same time that New York was hit hard. And we saw that the rate of cardiac events, unfortunately resulting in out-of-hospital arrests, almost doubled because people were not using the emergency medical service. And we saw similar statistics in the United States, especially for the New York area, in early April as well. So we want to remind all of our cardiac patients, if you are having a change in your health status and you acutely can't breathe, you acutely develop chest pain or sudden onset of shortness of breath, we would always want you to call 911 and come in and be assessed. Likewise, obviously symptoms of a stroke where you have word finding difficulty, loss of vision, or change in your ability to speak or move, we would also want you to call 911 and seek emergency medical care. And today, unlike back in March or April, most hospitals have really prioritized how they deal with emergency.
Think we lost you.
Uh-oh. Can you?
I can hear you now.
Can you hear me? Okay. Well, I guess that's technology. So I'll just repeat what I had said. So in situations where you have sudden onset of symptoms that are new for you, we would always want you to take that very seriously and call 911 and err on the side of really being evaluated by an emergency room physician and not waiting it out at home, because sometimes time is really critical to making sure that your heart conditions are stabilized. Number 4 on our list was continue to take your prescribed medications. And this is exceedingly important for the heart failure population. And I know most of you have probably worked closely with your personal cardiologist over years to get your medication regimen optimized. And it turns out that taking those medications regularly can really result in up to a 10-fold decrease in the risk of you being hospitalized. Especially early on in the pandemic, we heard from a number of our patients that were afraid to go to pharmacies, were not necessarily getting or taking their medications as regularly as they had been before. Hopefully this isn't the case for you, and hopefully your regimen has been very stable, but we do want to remind everybody that taking those medications on a regular basis helps to keep your disease state stable and probably provides you protection if you were to be exposed to COVID-19. And then we also want to continually assess how you're doing with the stress of the pandemic and really find solutions if things aren't working for you. And this really speaks to the complexity of living during a pandemic where we're not eating the way we normally do. We're not sleeping the way we normally do. We're not visiting with friends and family the way we normally do. Many of us are not exercising the same way we were a year ago, and certainly we're coping with stress very differently. And even though there is the risk to have severe complications related to this, Dr. Lee Lewis and I really want to underscore the importance of prevention and how important these lifestyle pieces really are in making sure that you're healthy and preventing things from going wrong, almost like you're training to be exposed to COVID-19. And we really want you to keep that mantra in mind as you're thinking about all these things that you do in the course of your regular day, the eating, the sleep, the exercise, and how you can really be working to keep yourself as healthy as possible. So just as an overview, I know most people with heart failure are very conscious about their diet, but we have really good evidence that shows us how food is actually medicine, and following a heart healthy diet can really stabilize your disease state, which is has been true, but is even more true now as we're all living through this pandemic. So your diet influences your blood glucose, your blood pressure, your insulin sensitivity, the amount of inflammation, how dilated your blood vessels are, and potentially prevents arrhythmia. So a whole host of really beneficial things from just choosing a diet that's largely unprocessed. So when we talk about eating a diet unprocessed, we're really talking about a Mediterranean diet that's focusing on fresh fruits and vegetables and some lean protein. Especially heading into the holidays, we'd like everyone to remember that sugar sneaks into almost everything we eat, and we'd really like you to minimize that to help keep your inflammation down and your heart function as optimized as possible. Choosing a diet that's largely unprocessed, some lean protein. We'd also like you to stay active. Exercise also does a whole host of things on the cellular level for your heart and for your vasculature. It maintains your body weight, it maintains your blood glucose, it improves insulin sensitivity, it reduces inflammation, it also improves your mental stress. So it's really important for you to be exercising on a regular basis. If your exercise routine has changed, this is also a great time to really be reinventing your new exercise regimen and thinking about how you can create new habits that may be different from your past habits, but will really serve you well. So just as a reminder, the American Heart Association recommends 30 minutes of moderate activity at least 5 days a week. We'd also like to see you adding in some strengthening or weight component an additional 2 days a week to really optimize your health. Exercise, we have loads of mortality data for. So if you ask me, how can I live longer? I will tell you this is one of the best ways that you can work to live as long as possible. There's a survival benefit if you exercise regularly. So that sweet spot is 150 minutes a week. The lines diverge almost immediately and continue on for years and years and years. So this is something that everyone can do, and we'll continue to see the added benefits. There's many ways to increase your exercise. We encourage you to set goals. So if you think about where you are today and where you'd like to be in 3 months, make a 4-week plan, make an 8-week plan, make a 12-week plan, and we encourage you to achieve those goals. You can use different tools. A lot of people are tracking their steps, or either wearing a wearable like a Fitbit or an Apple Watch. You can buy inexpensive pedometers. You can even just carry your phone with you. Most phones track your steps. And this is some way that you can really be competitive with yourself, right? How many steps did you get on average last week, and how can you beat that this week? That's a great positive way to increase your activity level. You can work to change behaviors by adding in a little bit of walking every day. If you just think about adding an extra lap around the parking lot every time you go somewhere, and think how that's additive over the year and how many more steps you'll get if you do that every time you drive somewhere. That's an easy way to increase those daily steps. Some of my patients have enjoyed choosing a partner during the pandemic And it might be a partner in a different way than you've done in the past. This might be a virtual partner where you're not able to get together, but you keep each other accountable. And that could be a fun way for you to get more active. And obviously, self-monitoring, making sure that, you're exercising on a daily basis for the time you've set aside, and really setting those personal goals are a great way to really shift the bar over the pandemic. So I've showed you a lot of data on lifestyle, exercise. If you achieve these, I just like to remind everyone that there's actually an additive benefit. So if you exercise, you eat right, you have optimal blood pressure, all of those factors that you achieve are actually additive. So the more healthy things you do, the better it serves you. And that's important for us to keep in mind, especially as we're all living a little differently than we have in the past. But you really should feel incentivized to be as healthy as possible and really reap those benefits. And you'll be able to see that over the next 3 to 6 months if you commit to living this way. I want to say a couple words just about stress in your immune system. Dr. Lee Lewis went over some of the pathophysiologic impact of COVID on your immune system, and how your immune system can actually be part of the problem when patients are really sick. So you handling stress and optimizing your immune function is really critical to staying healthy. It turns out that these are all stressful times for all of us, and living with the uncertainty and the change in our routine has the potential to impact all of us. We're sleeping differently, we're certainly eating differently, and we may not be exercising regularly. So the first step to improving this is to really recognize if we're having a problem with stress, and then I would encourage you to talk to your personal physician about finding strategies that are going to work specifically for you, and encourage you to incorporate in a focus on exercise and improving your sleep, because those have direct impacts on your immune health. There are a number of great resources that are available on the web or on your smartphone to assist you if you're interested in apps or learning more. There are mindfulness and meditation strategies. There are free apps such as Insight Timer that allow you to take a break and do a quick meditation at your convenience. Also, if you go to the NIH, the National Institute of Health website, and you type in meditation, there's a whole host of resources and videos out there if you are looking for other ways to reduce stress and boost your immune system. You can let science guide you. And I think as we're talking about prevention, focusing on the aspect of stress reduction and optimizing your health is so critical now more than ever. So that concludes our formal slide, and I think Dr. Lee Lewis and I are very happy to be speaking with you today, and are happy to answer questions and go through any of the science in more detail.
So we have 2 questions in the chat, and then people were sending me questions. So maybe we'll start with the chat first. How risky is this virus to someone with cardiomyopathy?
Sure, I'll take that one. So it depends, but cardiomyopathy, which is, for those of you who don't know, means disease of the heart muscle. And there's several different kinds of cardiomyopathy, but presumably we're talking about someone who has a weakened heart. So as I was saying earlier, it's not necessarily that that's going to put you at higher risk to catch COVID in the first place. But if you were to get COVID-19 and starting out with a weakened heart, that could put you at higher risk for getting really sick. So the first stage of disease won't matter whether or not you have cardiomyopathy. That's just, typically the low-grade fever, the chills, the aches, and the headaches. And hopefully your immune system is normal and strong, and you'd be able to fight it off and be one of those 80% of people who gets a mild case of COVID and shakes it off and goes on. But if you were to go on to get sicker to stage 2 or stage 3, where the lungs get involved and the oxygen levels might drop, and the maybe a higher fever, and the heart has to work harder. If you're starting out with a heart that's a bit weaker to begin with, it may be that you have less reserve to battle all those things that challenge your heart when you're sick. So low oxygen, spiking blood pressures, perhaps blood clots. And then if you were to get inflammation of the heart muscle on top of a weakened heart, say if you start out with an ejection fraction of 65%, which would be normal, meaning the heart squeezes 65% of the blood with each squeeze, and you get acute inflammation of your heart and it drops by half, well, you could possibly ride through that with an ejection fraction that's now 30%. But if you're starting out with an ejection fraction that's weak, say 20%, and you get inflammation on top of that and it drops by half to 10%, that might not be survivable. So for that reason, all of our patients who we see and take care of, Dr. Kelley-Hedgepeth and I, who have cardiomyopathy or other causes of weak heart, we tell them to be super careful, because not necessarily you're going to get more sick in the first place, but if you do get COVID, it could be just like any illness, the flu, COVID, a heart attack, anything that compounds what you're already starting out with, a weak heart, could be much harder to survive.
Thank you. And Vivian had a question which somebody else also wrote into me, and I was actually going to ask you after I got a notice from the Lown group, how do we know when the vaccine is available or what phase that we're in? And is that something, well, I'm just going to ask personally because I'm selfish. Do I come to you for that, or how do I prove that I'm, a higher risk patient, or what's that process like if you know anything about it?
You want to take that one, Alyson?
Yeah, so we're really fortunate that Pfizer has phase 3 trials that are enrolling high-risk patients, including healthcare workers. Unfortunately, those are being distributed state by state. So as soon as your doctor has information, they'll probably be rolling it out to you. But I don't think we have a clear national plan right now. There certainly will be some priority to those high-risk patients.
Okay. Another question, wearing masks, is it bad for us if we can't breathe?
Oh, I'll take that one. So a lot of people with or without underlying heart problems find a mask to be really uncomfortable, especially if you're exercising or walking briskly, or if it's really hot out, or if you have asthma or lung disease, or if you're just very sensitive to that feeling of having something on your mouth. It's not bad for you. It does raise your carbon dioxide levels a teeny bit and lowers your oxygen levels a teeny bit, but cloth doesn't really prevent the oxygen from getting into your body. So I'd say the biggest barrier is the discomfort, and that just your own sense that you don't like to breathe that way. But it's not a terribly dangerous thing for the vast majority of people who can just overcome that by breathing more deeply, or once in a while take it down if you're outside especially, and get some nice satisfying deep breaths. But it's not dangerous for you to wear a cloth mask.
Or even if we pair it with the oxygen sensor, I mean, that's your data proof that your oxygen isn't going down, right? And I'll just say I watched the Macy's Thanksgiving Day Parade this year because there was nothing else to do. I haven't watched that since I was a kid. But the Rockettes had that very high energy number, and they were all wearing masks, and they did it beautifully. So wear a mask. Susan, I have COVID, stage 3 heart failure, and age group 2, was extremely ill, had severe reaction to flu shot, so not sure about the COVID vaccine and if they're going to have. Now I know some vaccines are sensitive to some people, like with egg or anything like that. Have you guys heard of any? I think what she's asking is she going to have a sensitivity to this vaccine because she had a sensitivity to the flu shot?
Right. Yes, go ahead if you want.
So there's there's actually many vaccines that are in the pipeline. The Pfizer vaccine that is being actively distributed in phase 3 trials is an mRNA vaccine. So that's different technology than the flu vaccine. And we've been really impressed with the amount of severe reactions have actually been pretty minimal. This is something that, even though it was approved under emergency use, is undergoing rigorous and ongoing evaluation to make sure that it really is safe. But the efficacy looks high and the complication rate looks low. So I think we are really the most optimistic that we've been throughout the pandemic, because it really looks like we're going to have a viable preventative strategy. Certainly, if you've had reactions to vaccines in the past, that's going to be a conversation that we're going to want you to have with your personal physician. But I think the data right now is really optimistic.
Yeah, I add too that people who have an allergy to polyethylene glycol need to be really careful, because that's the carrier that's in both the Pfizer and the Moderna vaccines, again, which is different than the flu shot or other vaccines. And it depends on whether your reaction to the flu shot was an allergic reaction or just a reaction like you got the flu, and because of your underlying conditions, you didn't tolerate that really well. So people who have a history of severe allergic reactions need to see an allergist before they get the COVID shot, for sure. And that's the recommendation. So they check you components, and they can also do desensitization if you have to have the shot and you have an allergy to it.
And actually, I'll just add a question. Do you think for the vaccine we should be going to our primary? Now I know you work with my primary. We're all in the same system, but overall, is the primary physicians going to be the ones administering that, or should you go to your cardiologist? Or I guess you can ask everybody.
Yeah.
Oh, and Jill was just asking the same question. So yeah.
Great question. So Alyson, do you want to take that one?
So I think historically, cardiologists have also been very good about administering the pneumonia vaccine and the influenza vaccine, because we really know that it benefits our patient demographic. I think as the vaccines become available, there's going to be a little bit of sharing, I think, between primary care physicians and the cardiologists. And some of that rollout, I think, is just going to depend on how it's distributed. So I think there will, like much of what we've learned through the pandemic, there is going to be a learning curve, and healthcare systems are going to have to be figuring out how to allocate, how to identify the highest risk and get those patients identified in a timely way.
I have another question. How are you managing virtual appointments during COVID with heart conditions? And I'll say I kind of agree with this question. I was so happy to finally come in and see you, but I was so worried that no one was listening to my chest for 9 months, because I normally see you twice a year, and we held off until November. So are you doing anything special for virtual appointments, or how do we prepare for a virtual appointment with the cardiologist?
Such a good question. So virtual appointments can accomplish a lot, not everything, but a lot, especially if you have an oxygen meter at home, if you have a blood pressure cuff at home, if you have a way to check your pulse, all those things, and your weight, especially for heart failure patients, those things are really, really helpful to us. Some people have a little app called Cardia or an Apple Watch that can actually get a little mini EKG, and those things are really helpful to us too. So I would say, what can we accomplish on a virtual visit? We can review your medicines, your vital signs, hopefully. We can see a lot about you, how you're talking, how you're breathing, the color of your skin, the color of your lips, your energy level. We might take a look at your ankles to see if there's swelling, but you can tell us that too. Sometimes I have people walk around and see how they do with their vital signs walking. So it kind of depends. If you're in a stable phase of your process or your heart condition, and you feel great, and you're active, and you're exercising, and you're feeling well, and you don't have any new symptoms of being dizzy or palpitations or chest pain or shortness of breath, chances are a virtual visit will be just fine, and especially if you can get that information. But you're right, Maggie and other people, the time comes where we really want to get an EKG and listen to your heart and your lungs, and poke a finger on your ankles and perhaps draw some blood. So it all depends on the stage that you're at and the symptoms you're having. But it's not worthless to do a virtual visit at all. In fact, for the vast majority of our patients, it's been amazingly helpful. But sometimes we catch things we didn't expect when we see people in person. So it's important.
Cool.
I'll just add too that this highlights how important the partnership is, because I do have a number of patients that when they see me, they might not volunteer information. And then they say, oh, she didn't bring it up, so it must not be important. And guess what? That's not the case. So if you're at home and you're having symptoms, take advantage of the virtual visit and just discuss everything you're feeling and what situation, when things are bothering you, because the devil really is in the details. And we want you not to have that aha, we caught you moment. We want you to say, oh gosh, I understand why I'm doing this. You know, things are going smoothly. I have a plan for a week. I have a plan for 2 weeks. And then I'm going to check in again to make sure things are really stable. So I would encourage everybody to go into the virtual appointment with that mindset.
I mean, that's something I always ask whenever, like Tanny knows this, when we're at a seminar or anything for Women Heart, you know, what is the one thing you want your patients to tell you? And the answer is, like, how are you feeling? How are you doing anything? You're not going to be punished. And Dr. Lewis and I have a good relationship, and you really care about my quality of life as well. So telling you, hey, I'm really tired all the time, and then we kind of work with meds, and, you know, but if I don't tell you, hey, I'm like a zombie half the time, you're not going to know, you know, to even look at that. So that's something that for those of you watching now and those of you who watch later, it's really been helpful for me to have those conversations with you and have you ask. And now I obviously just volunteer. Yeah, I'm feeling good all day. No, I'm not. So that we can make adjustments, because it's, you know, your goal is to get my heart working as little as possible. But you want to have a good quality of life and not be a zombie, and be awake and functional, basically. So I know I agree with that. And the last question I have, unless anyone else is online, people are at different stages of this video right now. So, you know, hopefully these are the questions they would have. But any advice for eating out or shopping, additional precautions to take?
Yes, especially now that at least up in the Boston area, it's getting really cold. I'll take eating out, maybe Alyson, you'll take shopping. So for eating out, when we could eat outdoors, that seemed to be an extremely reasonable thing to do, because outdoors transmission is really, really low. It's most of the transmissions are taking place indoors when you are, here's the risk factors, face to face with somebody, talking at them without a mask for a period of time. 14 minutes is sort of a magic number for how much time you're spending face to face with someone. So a restaurant is all those things. It's, if the windows are closed and the doors are closed, it's a closed space. You're face to face with someone, you're eating and drinking. So by definition, you don't have your mask on. You're probably talking. So eating indoors with people is not a great idea. It's a high risk situation if you're indoors. If you can eat outdoors, that's great. But otherwise, I'd say get your food takeout and wait until the vaccine's here, or wait until you can be in a place that has free circulating air. Even the plexiglass dividers, which is a great idea, helps. It helps you from transmitting to the people at the next table, but you still have serving people, you still have the person you're sitting with, and you still have air circulating around. So I would avoid eating indoors in a restaurant for now, yes.
Mm-hmm. Yep, I remember in Milwaukee, we used to wear Snuggies outside when it started to get cold.
Perfect.
So we put those, and we had a Snug and Chug once. I probably shouldn't admit that to my cardiologist, but you know, it was Wisconsin. That's, you know, that's the fun of Wisconsin. Great food and drink. Jill has one. Any idea when the vaccine could be realistically available? I have a sneaking suspicion it's going to vary state by state, and not all is known yet, but I do understand more and more vaccines are becoming available with multiple suppliers, which is obviously a good thing. So, but any insight that you guys have, being closer to the information?
Do you want to take that?
So I think, you know, states are working to get a plan in place, and they're starting to vaccinate healthcare workers immediately, right? So I think in the next 4 weeks, we're going to have a better idea of you know, how we're going to be rolling this out. Unfortunately, Dr. Lee Lewis and I don't have any more insight, though, into how Pfizer is distributing them and how quickly that will come. So, but it is coming, and I think we all should be optimistic about this. And I'll just add in my 2 bits about eating indoors too, since that's important. You know, I think my take is, you know, we're all struggling for the fellowship right? And especially now in the holidays, eating is a way that we really connect to people. And so people do feel really isolated when you're not able to really gather and socialize and share a meal. So we have to, think about outside the box about how we can feel connected and not put yourself in that situation. But certainly you don't want to be in close contact, either shopping in high volume traffic indoors, right? And certainly eating. It's not worth the risk. The levels really are high nationwide. So protect yourself, let other people get sick, and don't let it be you.
Advice, yeah. I said goodbye to my husband yesterday. He went out to Iowa for Christmas, so I'm here with my cats. And my dad might come out, but yeah, it just was a little too risky. And his mother's also has heart failure. She might be actually watching this now. So hi, Sue. But any other questions, Tanny? Did you get any? I don't think I see any more.
Yes, I did have one.
Inbox.
Yes, I have one question. First of all, thank you both so much for making yourselves available to us. The question that was, does it matter which vaccine? I understand that there are several different types. I know there is Moderna, and then we know that there's Pfizer, and I'm sure there are going to be many more. But can you just explain to anybody that's watching here, and maybe we'll watch later, how this is not uncommon that different manufacturers produce our medicine, our vaccine, so that picky and stuck on which type that they're going to get, since we don't have a choice anyway.
Do you want to take that one, Alyson?
Yeah, so this has been really interesting from a scientific perspective to really watch this unfold, because typical drug or vaccine development typically takes 10 to 15 years. So what has happened in less than a year is really remarkable. And I think we see that because they lifted financial barriers from these companies so that they could continue with science and not be dependent on the profit in order for their vaccine to go forward. That's not to say that they're not rigorous with the science, right? It's just they're not tied to protecting their dollars, because the government has made that a little more accessible for all these companies. So so that's really exciting news. And you're exactly right. The same way we have multiple drugs in the same class by different manufacturers, I think we'll probably end up with multiple vaccines that are viable. And the vaccines that are actually going to phase 3 in the United States are not the same vaccines that are being utilized in other countries. So I think over the next 6 months, we are really going to have large-scale data from thousands and thousands of people to look at the safety and the efficacy of multiple vaccines. Dara, I'm sure you have some thoughts too. No?
Yeah, no, it's so interesting, but I think you're right, Tanny, that the bottom line is whatever we can get, we'll take it. And that holds for, me and Alyson and all the doctors too. We don't, even at Brigham and Women's, some of them are going to get Moderna, some are going to get Pfizer, and then the next type that comes in, you'll get that. So they just tell us all, keep track of which one you got so that the second booster will be the same type. But yes. A, you can't choose, and B, we don't have any reason to think one's better than another at this point anyway. So, I know there's so many questions about vaccines, and truly, we don't know how we're going to get it for our patients. We don't even know how we're going to get it for ourselves. So they're sort of doing a week at a time, and every week they give us a little peek more information, but they're projecting that millions of doses are being produced in the next few weeks, and probably over the next 4 weeks, all the phase 1 people will get, and then the next 4 weeks, probably phase 2, etc. But we don't know. I mean, at any point they could say, whoa, put a break on it. We've got to take a step back, change the dose or whatever. So, questions abound, but I agree. The lights at the end of the tunnel is visible. We just don't know where the end of the tunnel is right now.
Not
Okay, I have one last question.
Right, no, please.
One last question. Because I know we've noticed in the group that a lot of people are actually saying they're not going to take the vaccine. As cardiologists, yes or no, would you recommend we as heart patients take the vaccine?
Yeah, well, we'll both chime in on this. I'll go first. Absolutely. you want to weigh the risk and you want to weigh the benefit. And I totally get the skepticism. I hear that. I think there's a lot of reason that people are a bit skeptical. It just came out so fast. There was political pressure to release it fast. You know, maybe some early concern about side effects. But that being said, this is 92 to 95% effective in preventing COVID. And people who have heart disease are at higher risk, as we talked about, to get COVID and to get really sick from COVID. So might you get a sore arm and headache and chills, might even need to take a day or two off work from the second booster shot? Yes, 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 yes. But sure beats getting COVID. So my personal advice is, I hear you, I get that. You know, I'm a little nervous myself, but the second I can get it, I'm going to get it, and I'm going to urge all my patients to get it.
Mm-hmm.
I'll camp out outside the office. Hey.
Alyson, do you want to add anything to that?
I definitely agree. And, you know, I really advocate for most of my patients to buff up your immune system as much as you can through your lifestyle, right? So I think the way you're living day to day should reflect as well how you want a healthy immune system. So it turns out when you go to get your flu vaccine, if you're sleep deprived, you're not going to mount in as much of an immune response as you would have otherwise, right? And so we anticipate that with all vaccines, COVID included, right? So optimize your immune system, get a good night's sleep, be exercising every day, take all your heart failure medications, right? Be living your life like you really want to feel and live the best you can. And I definitely think the vaccine will complement that for sure.
Great. Well,
Thank you.
thank you both so much. We really, really appreciate it. For all the viewers, I know people are watching at different times and people will watch this after the fact. This will be in our video section, so you can go there to rewatch this. And then we'll be coming back hopefully in the new year with some new content. I know I have a stress test coming up and I'd like to do a little one-on-one of here's what it's like from the doctor's perspective, here's what it's like from the patient. And also I'll share the Lown Group has a fabulous weekly webinar series that's also on demand. So I'll share that link. They provided some really great content since COVID started. Really good stuff with Dara as well. So I'll share that for anyone that wants to see it. With that, I'm going to take us off live. I don't know if you guys can just catch up for a minute right after, and be good. All right, thank you, everyone. Have a great holiday, and see you in the new year.